Hi, this is Greg Remke. I run Economic Thinking, a nonprofit that teaches economics related to high school debate topics. So, a past high school debate topic was on public health policy. It was a Lincoln Douglas topic in 2015 for the University Interscholastic League. It's relevant in the news now as we have all sorts of state and national emergency declarations related to public health for the coronavirus that limits people's freedom in order to protect the public from an infectious disease. So the fall 2015 topic resolved when in conflict, an individual's right to self-determination ought to be valued above public health concerns. So that's an ongoing debate, a current debate. And so what I thought I'd do is I've updated the slides a little bit, but basically I'm giving that history and economics presentation. I'll be posting on this at the Economic Thinking on Facebook. Our Economic Thinking website has got some problems right now in mid-March, but should be fixed soon. So we've had a number of public health related topics and a number of crises in recent American histories. The AIDS epidemic, for example, was a great fear that we were all going to get AIDS, acquired immune deficiency. And in Texas and other places, there were concerns about mosquitoes that would, take blood from one person that might have AIDS and then land on somebody else who didn't, and that might be a transmission for AIDS apart from drug use and sex-related transmissions. So it was a real fear. So one of the Lincoln Douglas topics from the National Speech and Debate League was to quarantine people who had AIDS. So, grab everybody who's AIDS and quarantine them, isolate them so they couldn't possibly transmit it to others. Again, the fear was mosquitoes, not behavior in that case, or maybe part of both. It was fear and epidemic that led to a proposed severe restriction of individual freedom. At the time, I wrote an essay trying to find a way to go about this, saying, look, AIDS is a public health concern, but a bigger public health concern is, lack of economic understanding. People not knowing economic principles, not knowing the history and background of public policy debates. So I proposed quarantining everyone who didn't know economics. Just to make a point, it wasn't a popularly received article, maybe it wasn't well written, but the concern is that we can lose a lot of rights when the concern is public health, when we don't have all the facts. In the case of coronavirus, maybe it's a good idea to have enforced quarantine, social distancing, shut down everything. That's a policy debate, an issue for today. I'm suggesting people should have a background in the understanding the legal issues, historical issues with public health. Also, some years ago, there was a debate topic on public health and Africa. The idea that U.S. foreign aid should focus on improving public health in Africa. And in Africa, related to poverty and the climate, there's malaria, there's a whole range of infectious diseases. And so trying to deliver public health services, vaccines or cures for diseases, the big issue in Africa 15, 20 years ago, 100 years ago, and still today. So here we go. The debate topic resolution, which is a Lincoln Douglas value resolution for UIL, when in conflict, individuals' right to self-determination or of self-determination ought to be valued above public health concerns. So we could say you should convince people to isolate, or you could have private organizations, let's say the shopping mall, Targets, Walmart, saying, look, we're not going to allow people in our stores who haven't been vaccinated or who have a temperature. So there's all sorts of private sector ways to try and bring people to behave the way they ought to, but there seems to be a role for government. At least the case is made that some people won't, and so you've got to go out and restrain them in person. This was the case with Typhoid Mary. Typhoid fever was a huge public health issue. Typhoid being spread, I believe it was around New York. I may have the city wrong. And a researcher tracked it down and found out that all the infections were in a certain distance from a location. They tracked down the woman that had typhoid. They tried to stop her from working in restaurants and public kitchens, but she kept doing it, and finally they restrained her because her individual freedom, right to self-determination, was infecting large numbers of other people with typhoid. So the government stepped in to protect the public. The argument is she can do what she wants as long as her effort to do that doesn't harm other people. And when you've got infectious disease, whether it's typhoid or the coronavirus, your free actions do affect other people. If you sneeze in public, if you touch something that other people touches. So the argument is here's a way we can restrict people's freedom because their freedom impinges on the rights of others. Okay, so the background to this, public health has been a huge contributor to saving the lives of hundreds of millions of people. We think about the development of medicines and things to cure diseases, but really it was far more the effort to get clean water, to get cholera, reduce cholera and other diseases of cities. Over centuries, people would move to cities and die because the infectious diseases, cholera and others from person to person led to a mortality rate that was always higher than the birth rate in cities. Public health, the story of public health officials coming in and figuring out what was causing these diseases, lack of clean water, a sewage system that didn't clear out sewage, chemically treating water to stop these infectious diseases. These were key advances in civilization in the world, and there's still problems in the developing world and in some cities. Detroit, for example, or another city in Michigan, Flint, Michigan, I believe, where lead pipes led to lead being in the water, and that is a health hazard for people that are drinking water, cooking with water. So the broader question, how far should today's public health officials go in using force to reduce the remaining public health hazards? Of course, the coronavirus has exploded, and that is the major issue for today, but the people who are upset with the CDC and the FDA, federal and state public health agencies for what's considered an inadequate response to the coronavirus, the limiting of state and private and university testing procedures, testing kits. Part of that complaint is to say, look, your job, your one job is public health, and infectious diseases are a big part of that. What have you been doing over the last years, decades to prepare for an epidemic like the SARS that came before, flu epidemics, Ebola and so forth, and the current one? And so this is a criticism of the public health agencies who have expanded their mandate to lesser public health concerns and to politicized or social justice health concerns. So the current health conflicts that the CDC and others were full speed focused on ahead of the coronavirus was choices, people smoking, encouraging people to eat healthy diets, getting more exercise, addressing obesity, the vaping epidemic that was discussed. Well, vaping isn't an epidemic, it's a public health concern. So the thing is, when you've got dozens, hundreds of staff members and public relations spending and all these efforts dealing with smoking, healthy eating, exercise, obesity, vaping, that's money and expertise not being invested to prepare for actual epidemics, real epidemics like the coronavirus and others that might come in the future. Also the issue of vaccinations for communicable diseases. Vaccinations are sort of a major debate in a number of areas on safety issues. Everyone seems to agree that vaccinations are good. Some vaccinations are good, but maybe not all vaccinations. Maybe not 50 vaccinations, maybe not multiple vaccinations for children that are very, very young. So there is a debate over whether we've gone overboard with vaccinations. So that's another interesting debate. Again, these are public health issues. Here is a Reason magazine, a libertarian magazine or website. Can you be a libertarian in a pandemic? This follows the sort of joke, the story, in a foxhole in a war, Nobody's an atheist. They all want to believe in God because they're afraid of dying. In a pandemic, people may be libertarian, let people do what they want, but when there's a infectious disease around, people say, well, let's restrict the freedom of those people. Now we need government to do that. So there's been a number of articles saying, look, now's the time for government to be forceful, to be powerful, to do stuff, to not stand back. But that also is an issue to be examined. So this is a post on the Vaucliffe conspiracy, which isn't a conspiracy. It's a legal website of conservatives and libertarians writing on public policy issues. And so the link here, and the overheads will be uploaded, the link to them in the YouTube site and others, and you should be able to click on and find the article. Okay, obviously public health care is part of public health is part of healthcare. You see the very high rates of death in Italy, low rates of death in other countries compared to Italy. That has something to do with Italy's healthcare system. Italy has a state healthcare system where many other European countries are private, though the government is involved in major ways in insurance and regulation. So you could take part of this debate back and say, look, what kind of health care should we have? Should we have a single payer or a single system like the government health care in England or in Canada? Should we have private health care, a mix like we do in the US with government running Medicaid and Medicare and Affordable Care Act, Obamacare, but private companies providing services, hospitals being mixed? So this is a debate over health care. That's not the topic for this right now, but I think it's critical because to discuss public health, it depends on our healthcare system. So obviously these are related. Now today's U.S. healthcare system is high quality compared to most of the world, but it's also heavily regulated. It's far more expensive than quality healthcare you can get in Mexico, for example, or India. And you might say, well, gosh, I don't want to go to India for healthcare, but there are high-level certified hospitals and doctors in India, some of the best heart transplants and operations anywhere. People fly from all over the world to India to get inexpensive healthcare, but quality healthcare. So why can't, I mean, if that's in India, why couldn't we have, India Healthcare Corporation operating hospitals and healthcare clinics here in the U.S. so that we can get that inexpensive healthcare without flying to India? Those sorts of questions are part of the restrictive and regulated quality of U.S. healthcare. Today's system is mixed. It's part government, part private. And the private part, some are nonprofit hospitals, some are for-profit. In times with issues like healthcare or in times of emergency like the coronavirus, everybody brings their portfolio of grievances and preferences to the crisis. So the people that want government health care free for everybody say, gosh, wouldn't that be better if we had free government health care? People wouldn't, it would be less expensive, it would be better. Others say, no, the government regulations in current health care are so onerous, so restrictive. That's why it's expensive. That's why it's not as good as it could be. We have limits on the number of universities that can train doctors and nurses. In Washington State, where I'm from, we had one university, entire state could train doctors at a medical university, and they spent a bunch of money lobbying the legislature to try and block the other university, Washington State University, from opening their own program for training doctors. So why not? Why couldn't we have dozens of organizations training doctors? Why couldn't Walmart open their own medical schools and train doctors and nurses and run their own clinics? So these are public policy questions. Economists focus on the restrictions to entry. Why do you have to have a 4.0 high-level math degree to be a doctor? Why couldn't there be lots of less high-level but well-trained medical professionals? You want someone super capable to do brain surgery and other super complex medical procedures, but maybe the doctor you visit just to see if you've got a cold or a virus or what, maybe that person doesn't have to have a high-level, ultra-expensive medical degree from a college. Anyway, lots of questions about healthcare. Let me try and move on. And of course, you can move on anytime. Just skip ahead. But the point is we have a mixed system when things go wrong. The blame follows people's biases and preferences. So the coronavirus, people are going to blame President Trump, blame Republicans, blame the private sector, or free market people. Conservatives are going to blame the Obama administration, blame Democrats, blame government health care, the CDC. So there's lots of blame to go around. For debaters, it's valuable to research these claims and counterclaims and try and track back and see who's got what seem to be the most reasonable arguments. Research in history and economics helps us sort out these claims. And I'm arguing any public policy issue, unless you know the history of it, you're not going to know where the current conflicts and problems and challenges come from. The best book on this, widely regarded as the best book on how American healthcare and medicine developed, is called The Social Transformation of American Medicine, The Rise of a Sovereign Profession and the Making of a Vast Industry, by Paul Starr. And this book is a classic. It's been out for years, and what it's looking at are various steps that changed the way U.S. healthcare was provided and the medical industry developed. Used to be, for example, most Americans got their health care from their lodge or their club. You had lodge doctors, and if you were a member of a lodge, whether it's a Masonic lodge or a self-help organization, those lodges provided your health care for like 1/3 of Americans, provided unemployment insurance from your lodge brothers. It was recreation. You could go and drink and play cards and things like that. And they also had a doctor. And so you'd go to the lodge, and that was an early sort of HMO, health maintenance organization. Those were driven out of business by state regulatory agencies at the behest of the medical doctors, the AMA, American Medical Association. That's a fascinating story. Of course, the quality of medical care has improved as we learn more. So at the same time, the profession was professionalized, we had improvement. So it's hard to sort out which came from improving the quality of medical schools and which came from just advances in science and technology. But the Flexner Report in 1920 shuts down something like 1/3 of all medical schools in the U.S., saying they weren't good enough, shut down virtually all the medical schools for training African American doctors. So for decades, African Americans have to go to white doctors. These racial issues and historical issues, they raise the cost of medicine, they reduce access to doctors, but they also very much raise the wages of doctors. Doctors began to earn much more money than they did before because there was a limited supply of doctors. Now, part of it, they learned more, the training was more sophisticated, they were performing more sophisticated functions in terms of operations and surgeries, but the family doctor maybe wasn't heavily more sophisticated. Why should medical care be so expensive? Economists say because it's regulated, we limit the supply of doctors. And again, that's the healthcare side of it. There's a whole set of related issues in the public health side. Here's a public health story. This is a story in Boing Boing about the best public health person who ever lived, a Ukrainian man who worked on smallpox. So eradicating smallpox, this was the biggest killer in the world. The article goes on, a good contender for humanity's greatest achievement. Smallpox was a horrible disease, killed 300 million people just in the 20th century. That's through the 1900s. That's huge. That's more than the total death toll, all wars, genocides, terrorist acts, etc. So solving smallpox was an incredible public health achievement, and it wasn't done by a government agency. It was done by one guy. So 30% of those people infected died. The pain was unbearable. Survivors were disfigured. You read this in any historical novel. Lots of people are disfigured by smallpox. And there's more to the story, but the discovery that sort of cowpox with dairy maids, it turned out, didn't get smallpox. Well, how come? Well, it's because they got cowpox, a related disease from animals, and that gave them immunity from smallpox. So in 77, smallpox is eradicated. It's gone. So we still have other diseases. We have other issues. This one's gone. The story of how it was eradicated, discovered, worked on is an important one because, why do we still have the flu? It's because someone like this guy hasn't figured out how to solve it. Now, on the issue of public health, we also have legal issues. So, for example, for people that had smallpox and were infectious, what was the role of government in restricting their freedom? Again, for the UIL topic. So, smallpox, tuberculosis, malaria, typhoid, these are infectious diseases, and the question came up in terms of public health and the freedoms we have in the Constitution and the Bill of Rights. When can government take action? And again, the general rule is if your freedom is hurting other people, your freedom to swing your arm stops at the next person's face. If you're swinging your arm, hits them in the face, you don't have the freedom to swing your arm to hit somebody else in the face. Similarly, your freedom to wander around in public with an infectious disease is limited by the cost or the harm that you provide, communicate to somebody else. So that's where the government gets its range of powers. Back on the subject of the eradicating smallpox, tuberculosis, the other microbe diseases, the classic book on this is The Microbe Hunters, the story of the incredible people who fought against the status quo, fought against the accepted views, the doctors, the governments, and helped eradicate these diseases one by one. Tuberculosis, for example, was long considered a disease that couldn't be cured. Instead, it was one that was dealt with, palliative care. You would send tuberculosis victims, Robert Louis Stevenson, for example, they were supposed to go to Arizona or someplace that was hot and dry. There were tuberculosis places where people went to. The name escapes me immediately. And they were the TB popes, the people who were in charge of these. They thought all this discussion of a cure was hocus pocus. Instead, you needed to find the best treatment for people that had it so they could somewhat recover or not be in pain. Again, for the debate topic on Africa, where we had the topic was healthcare to Africa, I spent part of the debate season reading a whole series of books on disease, very depressing, but the role of diseases in human society. For example, when the Europeans came to the New World, most in the New World were wiped out by the diseases that were brought by the Europeans, diseases that Native Americans had no resistance to. It was argued, it's still argued by many that population densities in the New World were higher than in Europe until these plagues hit and just wiped out millions. These plagues hit the Europeans as well, but they hit during the Roman Empire. There's various plagues that came through and wiped out a third of the Roman Empire. The bubonic plague wiped out a third of Europe in the Middle Ages. So Europeans, partly because they had farm animals that they were close to and the disease back and forth, resistance was built up. Those who survived were resistant, but again, in the New World, they weren't. So there's a whole range of important diseases and history to study. We don't think about it when we don't get sick, when we don't have a coronavirus marching through the world. But it used to happen all the time, and it may happen in the future. So we should know the past to prepare for it. So this is an article from the Freeman or the FEE, Foundation for Economic Education, and it's looking at just the freedom and the right to self-determination, people's right to live life as he chooses. And for this UIL topic, this would be arguments for the affirmative on why why individuals have these rights and families. Property is not part of the state or any collective group or any individual. So how do we keep our rights and protect them in the face of the public health emergencies that are presented? Now, the challenge is, again, as I mentioned earlier, the CDC's had some mission drift. So ahead of the coronavirus, they were focused on trying to, stop people from eating at McDonald's, try to get people to eat less saturated fat and so forth. French fries at McDonald's are not cooked the way they used to be. They're now cooked in vegetable oils. They used to taste better and were cooked differently. That changed partly because public health pressure pushing people to vegetable or seed oils and away from the way things were cooked with lard and other animal fats. So that's a public health history, and critics of the status quo saying the CDC and other public health agencies have pushed us in the wrong way through a series of accidents. So smoking is a big deal. So the CDC and others are trying to stop people from smoking, teenagers from smoking, and so we've had, all sorts of regulations banning smoking, limiting smoking. Mayor Bloomberg in New York City, who was running for president until recently, he was a big public health guy. So there's a constant series of mandates in New York. No smoking in restaurants, no smoking cigars anywhere, no smoking this, no big drinks over a certain size with sugar, Coke, and so forth. More recently, the CDC has had a major promotion of trying to stop vaping or e-cigarettes, saying we've had an outbreak of lung injury associated with e-cigarette use or vaping. Now, recent research has shown that this is misleading, to say the least. All of the injuries that are related to vaping are from people using certain kinds of off-brand vaping things, marijuana or vitamin E or other sorts of things, and those are what causing all the damage, not regular cigarettes. So the CDC is trying to clamp down on e-cigarettes, and sure, you could say, well, gosh, this is not as good for your health compared to not smoking at all. But the people who are moving to e-cigarettes are the people who were smoking regular cigarettes. So people who are critical of the CDC say, wait a minute, if you're blocking e-cigarettes, you're leaving more people smoking regular cigarettes, and that's going to cause higher public health risks than what your policy is. So this is a worthwhile debate, but we might wish that everyone and everywhere would stop smoking forever. How do you get that? You could try and ban smoking. That pushes it underground. But as a public health issue, the vaping campaign is typical of the CDC campaigns that are, critics say, misguided in causing more deaths from smoking cigarettes that would be saved if people were using safer e-cigarettes that don't have the tar, have the nicotine for the rush, but don't have the tar. So here's the CDC website, Division of Nutrition, Physical Activity, and Obesity. So again, we've got limited budget. The government's, trillions of dollars in debt, deficit spending every year. We've got a lot of people at the CDC. Critics were critical of the Trump administration proposing cuts in the CDC, but this is a lot of what the CDC does, trying to get people to exercise more. Here are these happy people walking outside. If only more people would walk out in the sun, they'd be healthier, there'd be less obesity. But again, there's limited money for these sorts of things. Is this really what we want the CDC to do? If they're all focused, or so many are focused on these things, they're not ready for the coronavirus or other real epidemics that come in society. Also, another part of this story is the actual advice we've been getting from the federal government on reducing saturated fats, eating, the food pyramid, eating carbs, one thing and another. It turns out this may be the opposite of that turns out that butter, meat, and cheese that the CDC and other federal agencies are trying to reduce may be key to a healthy diet. And this has to do with a enthusiastic researcher who sort of got control of state and federal budgets, got control of the American Heart Association. This all comes from President Eisenhower, who had a heart attack. The argument was it was because he ate too much meat, butter, and cheese. So there ended up being a nationwide campaign to move to low-fat milk, low-fat dairy, low-fat yogurt, no fat. Turns out that may be the opposite of what good public health advice would have been. Turns out that as you take fat out of things like ice cream and desserts and other sorts of things, to try and preserve the taste to the public, you add more sugar. And in fact, the sugar industry was funding some of the research showing that fat was bad. So I'm not a public health expert. I'm not claiming that I know that, fat is good and sugar is bad. But one of the problems with having the federal government march on these campaigns is that when they're wrong, they're promoting these ideas in every elementary school, every middle school, high school, and colleges through federal funding, federal research. If you're not on board with this, you get your grant snatched away. So you can look at videos by this author. You can look at people who criticize these views. But first off, you say, look, the CDC shouldn't be involved in this at all. This is not something that the Constitution wants the federal government to try and do, tell people whether they should exercise or what they should eat. And when the government does that, they can be wrong. Now, maybe they're not always wrong. Maybe they're sometimes wrong. But it's hard to have a centralized agency have all the answers, particularly when there's new research. So you tend to have special interest groups control federal research, and they don't allow funding. They try and pull funding and stop people who disagree with their established views. Turns out the major advances in science come when the leaders in different fields die unexpectedly. When these leaders die, new people take over, and there's often significant advances that were blocked by powerful people having control. This was the case in tuberculosis. When you read The Forgotten Plague that was shown earlier, the leaders in tuberculosis research and the status quo steadily tried to stop new advances because they thought they were wrong-headed. It turns out young people from different disciplines often have insights. So this is a page on state laws having to do with public health issues, the HIPAA laws, Portability Accounting Act, and others. So lots of different, I'll skip through this. So the CDC, what are the big public health issues? Well, the CDC has 13 public health issues it deals with. Health care associated infections, protecting patients, saving lives. This is reducing infections in hospitals, and that's very, very important. Human immunodeficiency, HIV, stopping HIV, million hearts, preventing heart attacks and strokes. This is important. Again, this is part of the low-fat deal. The CDC thinks they know what's causing heart attacks, but it turns out there's no connection between fat in the diet and heart attacks, between high cholesterol and heart attacks. These were theories that pharmaceutical companies were enthusiastic about because they made drugs reducing cholesterol and so forth. But as you do this research on this, you'll find out that these are at least debatable, and even more, there's strong arguments against the views that were popular 5 or 10 years ago and are still part of the CDC. So again, a ton of stuff the CDC does. There's some more. So here's, again, people critical of the Trump administration trying to block CDC operations. Well, here's one. The CDC wants to do gun control, right? They think, look, people getting shot, it's a health issue, right? It's bad for your health to get shot. So why don't we have gun control so that people don't have guns, people won't get shot, and they'll be healthier? But obviously gun control is a separate political issue, and to try and sort of smuggle gun control in through the CDC seems questionable. Now, again, gun control advocates will say, well, why not? It is a public health issue. But driving is a public health issue. 30,000 people, getting killed every year in car accidents. So should the CDC be trying to make cars safer or trying to, mandate airbags more? Who knows? So there's an infinite number of things that can kill people, which are authentic public health issues that the CDC or other federal agencies should deal with. And the argument is infectious diseases are very different. They're not behavior issues. People choose to smoke or not smoke. They choose to exercise or not exercise. We'd like to nudge them in better health behaviors, but do we want the federal government to be doing the nudging? Nudging people to register their guns or not have guns. And here's another thing the CDC is working on, attaining health equity, healthy communities. So the CDC is promoting basically social justice issues, saying, hey, it's not fair that poor people have less access to health care. So the CDC needs to focus on helping communities address social injustice. But the money that goes to the states and agencies and nonprofits to pursue these goals, again, is money not available to prepare for infectious diseases, to look for cures or vaccines or whatever for coronaviruses and SARS and others. So here's the World Health Organization, the World Public Health Group, largest policymaking body, major health issues, preventing, communicable diseases, diabetes, heart disease, cancers. Again, this is going to be a low-fat stuff here, and stop smoking, chronic lung disease, monitoring the progress of making toward the Millennium Development Goals. Well, some of those goals have to do with eradicating poverty, vaccine preventable diseases. The Gates Foundation and others work on this. But here's number 3, supporting countries in their efforts to move forward to universal health coverage. So is that means everyone is wealthy enough to afford private health coverage, or through their club or community group or church? Or does it mean that the World Health Organization is promoting governments around the world to have national health care programs where everyone has health care as a right? And if so, that's a political issue that is separate from dealing with communicable diseases. You could do research and say, hey, in countries that have national health care, are they doing better addressing the coronavirus and other issues? Maybe that's an issue. But again, the challenge is, both with the CDC in the US and the World Health Organization, much of their agenda is political, toward policy goals that people prefer, instead of dealing with communicable diseases and public health issues as traditionally understood. So is really, universal health coverage. That doesn't sound like private care. That sounds like government care. The joke about England is everyone has free, bad dental care. Maybe it's better now than it used to be. Okay, so thank you for watching this. Again, the overheads are going to be in the comments section or description section of this video. Public health and individual rights. I mentioned we had a debate topic on this, on public health in Africa. We have an 8-page study guide with articles about this and some of the amazing history of public health. And then the overheads are on this link, and it's a complicated link, but if you click on it in the overheads, maybe it'll open up online where you can download it. Well, that's not going to work. No. So if you click on it in the comments section, that should open the overheads. Thank you very much. And if you have questions, please feel free to comment or email. Thank you.